coworker has fallen about 30 feet from a scaffold onto a dirt floor of a large open air pit. You respond with the ERT. As you approach, you find him laying on his back with obvious deformity to the right arm and blood on his pants at the right femur. He is not moving or moaning. It appears that his chest is rising and falling.
Okay. I have my PPE on. The scene is safe. It looks like I have one patient. My MOI is a fall. I'm gonna go ahead and call for ALS. I'm gonna have my partner hold C-spine. Hey, are you okay? Can you hear me? Does he respond?
No.
Okay. Does he respond to painful stimulus? I'm gonna pinch his shoulder.
No.
Okay, then I'm gonna check a carotid pulse. Does he have a carotid pulse?
It doesn't say.
We'll assume he does.
Sure.
Otherwise, this is just CPR. Okay. So he has a pulse. He is U on the AFPU scale because he's unresponsive. He did not respond to pain. My general impression is very poor, and his chief complaint is that he is unresponsive. So I'm gonna move into the ABCs. I'm gonna check his airway. Do I see anything in his airway?
Patient is snoring and gurgling red tinged frothy sputum.
Okay, I'm gonna suction the airway. Is the airway clear now?
Yes.
Okay, and I'm gonna go ahead and check his respiratory rate.
Which is, oh shoot.
While I'm checking that, I'm gonna go ahead and put in an oropharyngeal airway to keep his airway open since he's unresponsive. Does he accept the OPA? We'll assume yes.
Yes.
And did I get a respiratory rate?
Sorry, it's like 3 different pictures. Respiratory rate is 14.
Okay, respiratory rate of 14. So I'm gonna go ahead and apply high flow oxygen. I'm gonna have my partner use a BVM, so we'll do 15 liters per minute with a BVM. And that's my airway breathing. I'm gonna move to circulation. Do I see any major bleeding anywhere?
None obvious.
Okay, no obvious bleeding. What is his skin condition?
Cool, clammy, and pale.
Okay, and what is his actual pulse rate when I check it?
100.
Okay, I'm gonna go ahead and cover him with a blanket to treat him for shock and keep him warm. And I would like to transport this patient as rapidly as possible, but I have to get through my head to toe assessment first. So I'm going to, while I'm doing the assessment, I'm gonna have my partner get a full set of vitals, including blood pressure, and I'm gonna have them also get a sample history. So I'm starting with the head, checking behind the ears. Just stop me if I find anything. Checking the ears, pushing on the forehead.
There's bleeding coming from the right ear.
From the right ear? Okay, I'll just apply a gauze to control the bleeding. Do I see any cerebrospinal fluid in there?
No.
Okay, I'm gonna push on the forehead, open the eyes, check the pupils.